Hey there, everyone! Today, we're going to talk about a crucial topic that's been making headlines recently: the global emergency declared over a new mumps outbreak. So, let's dive in and find out what you need to know, especially if you're in Florida. First and foremost, it's essential to understand that a new mumps outbreak has been declared a global health emergency. This is a serious situation, and it's crucial to stay informed and take necessary precautions. Just a week prior, the U.S. Centers for Disease Control and Prevention (CDC) issued a health advisory, urging heightened vigilance for mpox symptoms among individuals with recent travel to affected countries. The risk of the severe mpox strain in the U.S. remains low. The CDC emphasized the importance of medical professionals being aware of the potential for this more dangerous form of the disease. A new threat emerges. Sweden has confirmed the first case of the highly contagious clade mpox strain outside of Africa. This development underscores the global nature of the threat posed by this evolving virus. Understanding mpox. There are two primary strains of mpox. *cladi, this more contagious variant is associated with severe illness and higher mortality rates. It is endemic to Central Africa. Recent reports from a Congolese mining town describe a particularly deadly form of clade mpox with a fatality rate of up to 10%. Clade 2, this strain causes less severe infections and was responsible for the global outbreak in 2022, resulting in over 32,000 cases in the United States. While the U.S. continues to report mpox cases, including a significant number in Florida, these cases are currently linked to the less severe Clade 2. Who is at risk? Individuals with compromised immune systems are considered most vulnerable to severe mpox infection. Experts recommend consulting with a healthcare provider to discuss potential precautions, including vaccination. Mpox symptoms and transmission. Mpox is a rare disease similar to smallpox but generally milder. Symptoms often include fever and a painful rash. While the situation is concerning, experts emphasize the importance of avoiding panic. The risk of clade mpox in the U.S. remains low at this time. However, the WHO's emergency declaration serves as a critical warning about the potential for global spread and the need for proactive measures to prevent a wider outbreak. Mpox Outbreak Update. Global emergency declared. This marks the second global health emergency declared by the WHO for mpox in 2 years. The current scenario presents a different picture. While similar transmission patterns are observed in Africa, children under 15 make up a significant portion, over 70%, of cases and fatalities in Congo, according to the Associated Press. Mpox in the U.S. In the United States, mpox continues to circulate at low levels, particularly among unvaccinated high-risk groups. This includes individuals with uncontrolled HIV, those who are immunocompromised, and members of the LGBTQ community. Gay, bisexual, transgender, and non-binary individuals. Florida Update. Scott Bertani, Director of Advocacy for the National Coalition for LGBTQ Health, emphasizes the continued circulation of mpox within Florida, particularly among high-risk groups. It is primarily found in Central Africa. Recently, scientists discovered a new strain in a mining town in Congo that has a fatality rate of up to 10% and may spread more easily. According to the Associated Press, Clade 2, this less severe form of mpox, was responsible for the 2022 global outbreak, leading to over 32,000 infections in the United States. While federal and state health officials are still reporting mpox cases in the U.S., including in Florida, none so far have been caused by the more contagious Clade strain that is currently spreading in Africa, according to the U.S. Centers for Disease Control and Prevention (CDC). As of this year, more than 1,000 cases have been reported nationwide, with Florida accounting for over 100 cases, most of which involve South Florida residents, according to preliminary state data. Carrie Debink, an associate teaching professor in the Department of Molecular Microbiology and Immunology at Johns Hopkins Bloomberg School of Public Health, advises against panic. She emphasizes that there have been no cases of Clade in the U.S., meaning the risk remains low for now. The World Health Organization's declaration of mpox as a public health emergency of international concern serves as a warning but also indicates that there is still time to prevent a global spread. Individuals most at risk, particularly those who are immunocompromised, should consult their doctor about precautions, including vaccination. Mpox, according to the AP, In the US, mpox continues to circulate at low levels, especially among unvaccinated, high-risk communities, including those with uncontrolled HIV or who are immunocompromised. The World Health Organization has declared a global health emergency over mpox, a virus of growing concern due to a recent rise in cases, particularly in Africa. There are two main types of pox. Clade I, this is the more contagious form of the virus, usually causing more severe illness and death. It is endemic in Central Africa. A more contagious and deadly form of mpox has been discovered in a mining town in Congo, raising global health concerns. This strain, with a mortality rate of up to 10%, has prompted the WHO to declare a public health emergency. Although this deadly form has not been detected in the US, mpox cases are steadily increasing in the country, primarily affecting specific communities. Individuals at highest risk for severe mpox infection include those with compromised immune systems. Certain communities, such as Black, Indigenous, Latinx, and LGBTQ+ populations, are disproportionately affected due to various social factors. While panicking is unnecessary, high-risk individuals should consult their doctors about preventive measures, including vaccination. Isolation is important for people with mpox until all symptoms have resolved. Health officials around the world are closely monitoring the mpox situation, and it is essential to stay informed and follow guidelines to protect your community.
Thanks for tuning in. Be sure to follow and subscribe for more key news and updates. Until next time, stay safe and take care. Stay healthy and keep smiling.